Emilia has taken a pregnancy test. It's positive. Emilia and Jonna have found their local neuvola online. Neuvola is a Finnish word for a maternity and childcare clinic. Her local clinic will see Emilia through her pregnancy and be the first port of call for care for her child. Emilia calls the central telephone service to book an appointment. The public health nurse congratulates the future family and asks how Emilia has been feeling. The nurse advises Emilia to fill in her personal details via Neuvola's online service system. During the first visit at the Neuvola, the nurse checks through all the information Emilia has filled via the online service system. They talk about Emilia's pregnancy symptoms, nausea, fatigue and sensitivity in the breasts. They also talk about both Emilia's and Jonna's diet, health habits, any substance abuse and physical exercise. The conversation covers any underlying illnesses, especially those that might have any effect on the pregnancy or the newborn. During the first visit to the clinic, they are also informed about the family training groups, physiotherapy groups, ultrasound checkups and the laboratory tests. The nurse wishes them good luck for the journey that has begun. New life has started, and this little human being is going to change a lot of things in their lives. In the extended health checkup, the well-being of the pregnant mother, the fetus, and the whole family is clarified. The expecting mother measures her own blood pressure and weight. She also takes a urine strip test to check the level of protein and glucose in her urine. The extended health checkup is split into two parts. It contains a visit to the nurse and then a doctor. The first stage of the checkup takes place between weeks 13 and 16 of the pregnancy and is undertaken by the nurse. The nurse will inquire about the general means of the expecting family, listens to the baby's heartbeat, and check both the test results from the lab and the due date from the scan test. The ultrasound picture will usually captivate both the parents and the nurse. Between week 16 to 18 of the pregnancy, the second stage of the extended checkup will take place with the doctor. The doctor will discuss the pregnancy with the expecting parents, listen to the baby's heartbeat, and palpate the uterus through the abdominal wall. The expecting families are offered family training in groups at the Neuvola. The group discussion covers parenthood, baby care, breastfeeding, and the baby's crying, sleep, and other key subjects. A family with a newborn baby will visit the first meeting to discuss baby care and their own experience as a family. The group discussions also cover the birth and its different stages, such as pain relief, different types of birth, the first moments with the baby after birth, and when to leave to hospital. Families are advised to visit Helsinki City's family training website, which contains information on family training issues and strengthening the parents' relationship before and after delivery. The hospital has produced videos that enable the families to make a virtual visit to the hospital, see different types of deliveries, baby care, breastfeeding, and settling down at home with the baby. Towards the end of the pregnancy, both the expecting mother and the fetus are monitored more frequently. It is usually quite easy even for the father to follow the baby's movements through the mother's abdominal wall. The nurse can even teach the father how to listen to the baby's heartbeat. The nurse pays a visit to the families who have returned home with their first newborn. Families with more than one child will attend an appointment at the Neuvola. At home, the nurse discusses the birth experience with the parents, their feelings on the first encounter with the baby, and how life at home has been so far. The nurse checks the baby's reflexes, and weighs the baby with portable scales that she's brought with her. The home visit gives the nurse a chance to follow the breastfeeding and to give some tips with both feeding and baby care. During the baby's first year, the family will visit the Neovilla frequently, usually 10 times. After that, these visits will become more intermittent, with the child visiting Neovilla 6 times before school age. At the age of 4 months, 18 months and 4 years, the children have extended checkups, which will cover the entire family's health and well-being through a pre-completed questionnaire. At the 6-month and 2 years checkups, the nurse advises the parents on the child's dental health. 3- and 5-year-olds are directed to the dental clinic for their checkups. The nurse follows the interaction between the parent and the baby, supports the mother's breastfeeding, and checks the baby's reflexes, weight, height and head circumference. During the clinic visits, the children also get vaccinations according to the Finnish National Vaccination Programme. A 4-year-old child's growth and development are monitored carefully. The idea is to find out as early as possible if a child needs special support in its development before school. At the 4-year checkup, both parents and the kindergarten give their summaries and views on the child's development. The nurse checks the child's growth, vision and possible squint. With a large neurological functional test, the nurse can find out if the child has any special need for an occupational or a speech therapist or physiotherapy. The discussion with the parents covers both the 4-year-olds and the whole family's health and well-being. 4-year checkup also includes a doctor's appointment. Children have their last checkup at the Neovilla when they are 6. Again, the nurse pays attention to the child's growth and development and vaccinates the child. A summary of the child's health and development and possible illnesses is made for the school healthcare. The nurse will make her final remarks on the child's health card and wish them good luck for starting school.